Welcome to the free Smileworks Ultimate Guide to Oral Hygiene Gadgets with Bambi, our therapist, and MJ, our captain.
Hi, I'm MJ. I'm the dentist here at Smileworks. This is Bambi. She's our wonderful new hygiene therapist. She qualified last year at the University of Salford, and she's currently doing an orthodontic therapy course at the University of Preston. And she's going to tell you a little bit more today about things you can use to brush your teeth.
What are you going to be doing here at Smileworks?
So I'm going to be looking after people's gums, educating them how to look after the gums at home, and also doing fillings as well.
I hear you've been on some fancy composite courses for posh fillings.
Yeah, we can do composites on your back teeth and your front teeth so that they blend in and look like natural teeth.
So the first oral hygiene gadget we're going to talk about is the mighty TP. Tell us a bit about intraoral brushes.
So when you're using a normal toothbrush, you only get 60% of the tooth surfaces. So these little TP brushes are like little pipe cleaners, and they just clean the areas that your toothbrush can't get to. They come in lots of fancy colours, which are all colour coded for size. So when you come in for your appointment, we can size you out and get all the right sizes and get you going with them.
What's your view on TPs, MJ?
TPs are wonderful. They get in all the little nooks and crannies. A lot of people say, oh, well, what's the difference to dental floss? I mean, dental floss is wonderful, and if the floss is for you, that's cool too. You wouldn't go and clean your bottle with a noodle. You'd use a bottle brush. So clean in between your teeth with a pipe cleaner, and that's the sort of a similar thing.
So Bambi, in my oral health kit, can I live without TP brushes?
Some people's teeth are too tight together, so they're limited to floss, but especially if you've had gum disease, a piece of floss would only kind of go in and it'd only kind of do half a job. So the TPs that we size you out with really thoroughly clean the gaps and make sure there's no food debris or plaque left behind. So it's really important in preventing gum disease.
Let's talk about floss. Has floss had its heyday?
Floss has its place, and some people like using it. And like Bambi said, if your teeth are too tight together, or you have healthy gums anyway, because you obviously look after them, then maybe floss is for you. It gets out little pieces of debris in between your teeth, and for those that have got bigger spaces, you will need to use TP brushes, so you will need to use something that cleans the space better.
So Bambi, the floss harp, is this a waste of time, or is this a useful dental hygiene tool?
No, they're good. A lot of people prefer them because it's not as fiddly as wrapping floss around your fingers, especially if you're a man with really big hands. It can be almost impossible to get to your back teeth, so they do have the place that can be really useful as well.
Air flosser, is this a flossing force to be reckoned with?
It's a lot of money for a sort of a jet of air and water, which you could reliably do with a tool that is much, much cheaper.
And sometimes if it's like a film, the bacteria is so tiny, the air flosser will get rid of bigger lumps of debris, but it doesn't remove the film, whereas physically going in with a brush gets rid of that, and that's the stuff that causes most of the damage.
So just to clarify, the biofilm, it's like a sticky layer of bacteria, and we need to penetrate that biofilm. So is an air flosser not going to do that?
Not really.
Not as well, no.
So are the beautiful people of Liverpool wasting 60 quid on an air flosser?
You can do the job with cheaper tools.
The electric toothbrush, do we all have one of these?
I have an electric toothbrush.
Good.
I have a Philips Sonicare.
I have a Philips Sonicare. What are the most important things to look for when you're buying an electric toothbrush?
That it's mains chargeable, because if the battery runs, the batteries slowly run out and you don't notice. And it's got a really small head on it, because a lot of them have got really big heads and you can't reach all your back teeth. And that you change the head every 3 months, that's really important.
And circles or vibrations, there's lots of vibrating ones out. Are they better?
6 of one and half a dozen of the other.
Yeah.
The studies show that there's no significant difference in the plaque removal of one or the other. Colgate will tell you theirs is the best, Oral-B will tell you theirs is the best, Sonicare will tell you theirs is the best. It's just whatever floats your boat. Some people like vibrating things and some people like rotating things. But the way that they remove the plaque and the bugs on your teeth is all about where you stick them.
So I can't afford an electric toothbrush. Which is the best manual toothbrush, Bambi?
Anything as long as it's got medium bristles and just a nice small-headed toothbrush.
Flintstone 3.5?
Flintstone 3.5.
Flintstone 3.5.
TP as well make a really good small-headed toothbrush as well.
Okay, cool.
So we recommend the Sensodyne 3.5, which looks like a child's toothbrush, and it comes in all the colours of the rainbow. But it's the one that you can get right around the back of your back teeth, and it's the smallest toothbrush I did. It's wonderful.
Just for clarification, we don't have any affiliations with these FMCG companies. They're all made by the same freaking people. Brushing, when you've got gingivitis, you need to brush more. So why isn't a hard toothbrush better?
Because if you brush too hard, you can abrade your gums, and plaque's only soft, so medium bristles is fine. You can damage also brush away tooth surface with a really hard bristle brush and end up causing trauma. So medium bristles and just medium force is fine. You don't need anything hard.
And what about all these toothbrushes with fancy widgets and gadgets on them? Like some of them have little like florets coming out of the side.
Rubbish.
The only thing you need on a toothbrush is bristles, and everything else is a given.
Taking up bristle room.
Yeah.
And it just makes them too big, so you can't reach your back teeth.
So Colgate and all the rest, they make a wonderful gadget accessory for your wash bag, but it doesn't really. There's all the suckers and the widgets and the bodgets and the rubbery things and the little suckers that you can put them on the bathroom mirrors. But there's just no point. And the Sensodyne 3.5s don't even have a colour indicator. So go with some
mouth rinse. Now, I was always a big fan of Listerine. And you're going to tell me that's not a good thing.
Listerine is the socially acceptable mouth rinse.
Right. So what isn't mouth rinse good? I mean, I've brushed my teeth, I've got rid of all the plaque, I rinse with mouth rinse and I feel fresh like that freaking dragon. What's wrong with that?
You're washing away all the toothpaste, so the fluoride in the toothpaste gets rinsed away by the mouthwash. So if you mouthwash, you're best doing it at different times to brushing.
Okay.
If you want to have a socially acceptable boost, do it before you brush your teeth, which is good too, and then do not rinse off your toothpaste. So your toothpaste should be the last thing in your mouth. Don't rinse it off. Spit it out. Don't rinse. So that was our wonderful new hygiene therapist, Bambi, who has recently joined our team here at Smileworks. So if you're worried about bleeding gums, smelly breath, or any issues surrounding your gums, then do come and see Bambi, book in and see her, and she will be able to fix those problems right for you.